speaking of supplies, there's a lot of new people coming into the preparedness community right now, right? You look at some of the Facebook groups, and there's some of the bigger Facebook groups I know out there that are adding 2, 3, 4, 500 people a day right now. Wow. And one of the questions I get asked a lot is, hey, where do I start? What do I need? When it comes to the medical supply side of the house, if you're starting from zero right now, what do you recommend somebody look at to assemble a kit that will, and maybe have one on your site that will get them up and going so that they're fairly confident in what they have on hand?
Okay, hands down, the first thing they have to do is buy the book. And I'm not saying that because I made the book. I'm just saying this because this is going to help you organize yourself. I have a huge section in here just on medical supplies with a checklist, with a little box that you can check off. And it goes on and on: family, community, hospital, OB, eye supplies, herbal medicine supplies, pediatric supplies, dental supplies, on and on. So this is where you can organize yourself, and you can go in there and say, okay, I have this, and this. Now I see these other things that I'm missing. And it helps you think about maybe how many people you're going to be taking care of. We go through some of the things we talked about, the skills that you need to learn, where you can learn them. I mean, this book really brings all of the medical education together.
And I'm so glad you mentioned dental, because we have an entire section on dental, everything from how to identify a decaying tooth to how to extract the tooth if you needed to. People don't realize that let me say this, that during Vietnam, 50% of the sick call patients that presented to medics there were for dental reasons, not for medical reasons. Right. So if you're going to be the medic for a survival group, and you're going to end up off the grid because of some society-ending event, you're going to be seeing as many people there for issues relating to dental problems as you are for medical problems. That's and so true. This is why it's very important for you to have some knowledge with regards to that. There's a good book called Where There Is No Dentist. Yep. That's very useful. We have an entire, our section tells you everything that you need to know with regards to,
pulling teeth,
teeth that are knocked out,
how to fill,
broken teeth, how to replace lost fillings. There's that's part and parcel of being an effective medic.
All right. So step number 1, get the book, get it in color, because the pictures we added are pretty amazing. Yeah. I don't know if you've seen the color version, but when we go through our trauma, I mean, it's just incredible how to step-by-steps in here. So we don't leave you hanging. We don't say, oh, go do this, and then don't tell you how to do it. So that's one of the changes we made from the 3rd edition to the 4th edition, was we pulled out some of the text, because my husband likes to be, sort of professorish. And I said, well, in nursing, our nursing books, the way we learn things is we have it numbered. And this is the first thing you do, and the second thing you do, and the third thing you do. And we follow that, that's our formula. Whereas, doctor books are very like, oh, and you have this and you might have that. I'm like, okay, now we need to pull this down. That's great. I'm loving what you're doing there. But now let's tell them exactly what to do. So there are hundreds of how-to in this book. That was like my touch of this book, was we're going to pull the words out of the paragraphs and we're going to just throw it there. And this now they know what to do. Do this, and this. And when you get to the bottom, you've completed your task. You've either inserted a Foley or delivered a baby or cleaned a wound or stopped bleeding, but all these things are in here. So it very much organizes, what you're going to do. So anyway, that would be the first thing. So before you even buy medical supplies, get a book. If you want our book, great. If you want something else, that's fine. Just get a book so you can then organize yourself, because you just start buying stuff and that's not helpful, because you might not cover an issue that was really important that you completely forgot about, like
dental
or people having babies, that's going to happen. So if you just want to start with a basic kit, I always put gloves, masks, hand sanitizer. You want to grab some instruments. So things like scissors, tweezers, some different kinds of clamps, long clamps, skinny clamps, clamps with teeth, clamps that are smooth, stethoscope, blood pressure cuff. You want some lighting. Headlamps are great. Make sure you have always extra batteries or way to charge it. Flashlights, because things happen, 12 hours of nighttime and 12 hours a day.
Headlamp, actually.
Headlamps, flashlights, reflex hammer. There's lots of instruments. Think of when we're talking about orthopedic, ice packs. You're going to need to get those instant ice packs. If it happens to be winter, make sure you get those ice bags. You can do those blue ones with the screw top we've all seen forever. The heat bags, the hot water bags, the red ones, because it'll be easy to heat water. It's not going to be so easy to cool water, but you want to be able to do both for orthopedic. Ace wraps, SAM splints, those moldable, pliable splints. I happen to have one right here. These are great. You can fold them up. You can use these on arms by folding it up and making them smaller. They also make a neck collar. They're really good for a lot of things. So SAM splints, moleskin for blisters, mylar blankets for keeping people warm. Bleeding. So you want your hemostatic gauze to stop bleeding. You want different kinds of tourniquets, different sizes. Even the stretchy ones are good for little kids and really big people. Gauze. I think we talked about gauze a little bit. Sterile and non-sterile, different shapes, sizes, tons of Band-Aids, again, different shapes and sizes. You want tapes to hold these gauzes on, adhesive, paper, duct tape even. You can get the Coban. It's also called Coflex, which has a sticky side. Those are great for holding gauze on because then you don't have to put tape on the person. Older people have very thin skin, and tape after a while can even start pulling skin or even hair off somebody who's hairy. So Coflex, Coban can hold on gauze very nicely and even be reused if it's not didn't get dirty. Burns, think of things like non-stick gauze, aloe. If you can get an aloe plant, that's beautiful. Honey never goes bad. Raw unprocessed honey will last till the end of the earth, and beautiful treatment for burns. Soothing. Someone's got blisters, the blisters pop. Even like the most severe burns. I mean, things that people might not survive in grid down situations because they need burn units after a certain percentage of burn. Your raw honey may be your only hope to prevent infection in those burns and help with the healing. It's a beautiful consistency for healing bad burns. Different meds. You talked about some of them already. Benadryl, Tylenol, your ibuprofen. Aspirin's great. Don't give it to kids. Nobody under the age of 19. Antibiotic creams. But again, you can replace antibiotic creams with raw honey. So basically any boo-boo, any cut, any chink in the skin whatsoever, clean it really well, put raw honey on it, and then cover it up. It will heal beautifully, and it's unlikely to get infected. Do
you have to change the honey out ever? Or do you just let it sit there?
Add more. Just add more. Yeah, it's going to get pretty runny because our body heat's going to make it runnier, and it may leak out. So just keep filling it up. Just keep putting more raw honey in it as much as you can while it's healing.
It's a great thing to have it, but it can be messy. You just have to know that.
But we're trying to, again, good healing and infection prevention. You did talk, I think, a little bit about diarrheal issues. Killed more people in the Civil War than gunshots. So think about that. Have some rehydration packets. Again, things that are dry are going to last a lot longer than things that are wet. So you don't want to stock really up on Gatorade liquid,
right?
But anything that's dry powdered that you can add to water would be great for dehydration. So you want to think about that. There's a million other things. Again, I could get into different types of kits, but that's just a general thing.
No, that's a really great overview. I think that's a lot. That'll get people started in the right way. And hey, if you want more, head on over to doomandbloom.net. They got everything you need.
Absolutely.
I did make a baby delivery kit. I actually have one based on when I used to deliver babies in the hospitals. I actually found the same kit that we used to open up for the delivery.
It's exactly the same
part of the kit. Same kit I use from the same company.
Oh, wow. That's awesome.
Yeah. It comes in a sterile kit. Yep.
Yeah. You never know. It's, being a medic for years, I have Foot Lockers full of old bandages and all kind. I mean, blood pressure cuffs and all that. I'm never getting rid of it. And because like you said, you can never have enough, especially if we do end up in some sort of limited supply thing, which like we talked about at the beginning of the show, with COVID, you were already seeing that, and society hadn't buckled that much. So,
yeah.
Oh yeah. There are still some supplies that are on limited purchasing. Still. Wow. I know. And some never came back. Like certain types of gloves and masks, they just changed manufacturers. They couldn't even get them anymore. It's incredible. Wow. And this is the company I buy from, is the biggest hospital supply company in the United States, Medline. That's who I got my stuff from. Yeah. Yeah.
That's crazy. Yeah. And that just shows that shows, hey, get it while the getting's good. It was when I left Vegas in March of 2020, I went up to Michigan to get out of I didn't want to be in Vegas with the lockdowns and everything that was coming. Yeah. And the last time I was still doing my PTSD therapy time, seeing my therapist once a week. And my last meeting with her, I handed her a plastic bag with 2 N95 masks in it. And that was probably February. And she was like, what are these for? I'm like, you'll be hearing about.
You'll find out soon enough. Oh yeah. Oh yeah.